and Wealth Radio Network. 1470 AM and 95.3 FM. The Health and Wealth Radio Network. Listen for A Touch of Gray, the talk show for adults, with Carol Marks and Michael Harrison, Saturdays at 1. Now you can get Talk 1470 WNN on 95.3 FM too. Loud and clear, Health and Wealth Radio, WNN.
Times are tough, and right now those in the commercial world know that being heard via advertisements is the name of the game. AmpSquare.tv understands how important advertisement is and is proud to express that it's truly the only plugged-in internet television production company on the market. Amp2.tv live streams all their shows across all the major selling markets in the U.S. and abroad. Call them at 866-224-5422. The AmpSquare.tv library allows productions to be seen over and over again, making commercial platforms more usable. Call 866-224-5422. Toll free 866-224-5422. Amp2.tv, the first and only internet television network that's truly plugged in. 866-224-5422. That's AMP2.TV. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome. I'm Lorena Anderson. This is You and Your Doctor, where we're teaching you how to live a longer and healthier life. We're being sponsored by All County Healthcare, which is a Medicare-funded, a Medicare certified home health care agency. And I'd just like to say thank you so much. We're here every Tuesday from 6 to 7. You can find us live. And we're also streaming live on Amp2 TV, of which we're being presented by this evening. And you'll find us on allcountyhealthcare.com. We have many different shows that we have taped over, I think it's almost the past year. So if there's any type of shows that you have not been able to see, they will be on that website. We're also streaming live on All County Healthcare Facebook page. So please join us. Also, if you have any questions this evening, you can call us here at the station, 1470 AM or 95.3 FM at 888-565-1470, 1470. And we would love to answer any of your questions. And we've got a wonderful doctor here this evening who's going to give us some insight about her specialty. So without any further ado, hi, welcome. It is so great to have you, Dr. Freedland. It is wonderful to have you here. Please tell us your specialty.
I specialize and am board certified in obstetrics and gynecology. However, we also specialize in adolescent care all the way through menopause, including our pregnant patients that we take care of and deliver as well.
Oh, my goodness. So you run the full gamut there.
We do. It is very nice to be able to treat patients from their adolescent stages all the way up through menopause.
That is incredible. So you must have a long standing relationship with a lot of your patients.
I do. I have many patients that I am now meeting in the mall that are 12, 13, 14, 15. Yes, and it is very nice.
Oh,
yes.
My gosh, that's amazing.
Yes.
And did you help birth birth them as well?
I did. Yes,
gosh.
I did.
So you get to see the whole entire lifespan of
We
these.
do, which is very nice.
Oh, so tell us a little bit about you. Where do you come from?
I am a Philly girl, so I'm originally
okay.
from Philadelphia, which is where I was born and raised.
Okay.
As well as my training occurred in Philadelphia as well, through Philadelphia College of Osteopathic Medicine, and my residency training was through that program as well as through Jefferson, Temple, many other hospitals throughout that surrounding area at the time.
How long were you in those hospitals?
Our residency program was a year of internship and then 4 additional years of residency and specialization.
Wow.
Yes.
That's a long time to be in school.
It is.
But,
And then I found myself here in Florida once my mother moved here. And because I did not wish to shovel myself out before deliveries in the middle of the night,
oh my God.
I chose to move here, which is where I have subsequently been. And then most recently, since about 2006-07, been in the Boca area.
Oh, that's wonderful.
Yes.
Yeah, I totally agree. I'm from Chicago, so I totally understand that. Oh, my goodness. But, something, it sounds like the schooling and everything that you've had has really allowed you to speak to the various age levels of your clients,
It has,
your
yes.
patients. Yep.
In addition, I have also done training through the Anti-Aging Academy of the University of South Florida, which is the A4M. So I've gained board certification with regards to anti-aging.
Well, and give us a little bit of insight, because it's so common to hear anti-aging everything.
Yes.
What particularly are you speaking about?
In basic menopause, andropause, which is for our male listeners, because we do go through that as well.
Andropause.
Yes, and most people don't find until we actually speak to their partners that their patients have symptoms. So menopause, for instance, is merely a definition meaning 1 year without a period. All of the symptoms that occur from your late middle 30s all the way up through until you're 1 year without menopause are all of those symptoms that occur during that time. Males, on the other hand, probably starting in their mid to late 30s, go through andropause. Those symptoms, which are very similar for both male and female, include, obviously, which everyone wants to know, yes, changes in libido, but more importantly, changes in your eyesight, dry eyes, mental acuity changes. People feel like they have a sense of brain fog. Most men feel as though they don't have a great mental focus and clarity any longer, which is the same thing that happens to us as well as your testosterone levels begin to decline. Thus follows suit your changes in metabolism, your thyroid, your vitamin and nutrient levels. Patients who are diabetic, patients who have cholesterol issues, all of these things spiral when your hormone changes begin to occur at these ages. A lot of times, as I even had a patient today, wound up in the hospital for cardiac issues because she was having anxiety, she was having palpitations, and she went through an entire cardiac workup in the hospital, and all of these are menopause-related symptoms.
I have not heard about that. That's very interesting.
Yes.
You usually hear about the normal, hot flashes, the night sweats, the foggy brain.
Correct.
Sleepless nights.
Correct.
But I've not heard how it can attack your cardiac and anxiety and those type of issues.
All of these are due to changes in various hormones in our body, yes.
And it starts at what age?
It can start in your mid to late 30s.
Oh, my goodness.
Yes, yes, absolutely.
Oh.
Now, there are various methods of treatment for all of these symptoms, with patients that have, perimenopausal symptoms, men that have andropause symptoms. And, they range from course of utilizing creams, bioidentical hormone creams.
Okay.
Utilizing subcutaneous hormone pellet therapy, which is what we specialize in for our patients.
Well, tell me a little bit about the pellet therapy. What is that about?
So pellets are about the size of rice grain.
Okay.
They contain the steroid components of soy products. So, for instance, if someone is allergic to soy, they should not be allergic to the product that's utilized. They
wouldn't be?
They would not be, no.
Oh, okay.
They contain those specific hormones, which are determined for each person individually based upon someone's height, weight, BMI, their past medical, past surgical, family histories, certain laboratory work that we order, which includes a full thyroid panel. Some patients will say, well, I already had my thyroid levels checked. Yes, you may have, but we run a full gamut of antibody screens, certain thyroid testing,
so it's
nutrient levels.
Much
it's
different,
much more in detail, yes.
Gotcha.
And all of those things help us to determine what is needed to replete someone's system in whole and in total. So we're not just looking to replete someone hormonally, we're looking to replete someone in total based upon all of these, factors that have become out of sorts for someone.
That is really interesting, because you would not think, being a female, that at age 30 I would start going through the perimenopausal period. That
each person is different. Each person who begins their cycles at different ages, and depending upon what they go through in their lifetimes, will base on these symptoms starting at earlier ages, some at later stages of life. But the important thing is to try to note and look at the symptoms that you're having. Don't let someone just start you on an antidepressant because you're feeling down or you're anxious or you're depressed. Look elsewhere.
Wow.
This is a gynecological issue, yes.
I'm pretty much shocked, because I have not heard that before. But that is really, that's a breakthrough. That's just something that I don't think I've ever heard any other doctor talk about, is how, the hormones and everything can really disrupt your everyday normal lifestyle.
Absolutely.
And, wow.
Yes.
And at such a young age as well.
Correct.
And let alone with men. I mean, talk to us more about that. I mean,
Sure.
how did that discovery happen?
Pellets have been around since the 1930s. But you will hear, and I'm sure, males will hear about injectables, they'll hear about creams. Really, you want something that is going to affect good steady state levels, be protective for your heart, your brain, your bones, besides obviously our genital organs, which is the use of something that is subcutaneous therapy, which is what pellet therapy does. It is measurable in the bloodstream, whereas when someone uses injectables, it may possibly be, but not at a steady state, nor is creams.
So where did they put the pellets? I mean, it's up under the skin, I take it?
Yes, so the pellets, because they're about the size of rice grain, what we do is we make an incision about half the length of a fingernail's width in the top area of the cushion part of the hip, and they get placed similar to an injection beneath, where they absorb over time. 6 weeks after, for females, we are drawing labs again, because we're looking to see an optimization in therapy for patients. Now, the same for males. Males have theirs drawn 4 weeks after. This is the only time in our lives, I think, that males actually have a little bit harder time, because they require more therapy and more pellets than we do. So their timing of getting their blood work's a little bit different. Their timing of having to rest following their therapy is a little bit different as well.
Does that have anything to do with the various levels of testosterone that they're dealing with?
Correct,
and that's one of the reasons why it takes longer.
Yes.
Okay.
Absolutely.
Okay. So, and I think, does that have something to do also with low testosterone?
Correct.
Levels?
So when we're talking about low testosterone, we're talking about both males and females. You're looking to optimize patients' therapies. We're not looking at reference lab ranges. We're looking at studies that have shown that patients feel well at certain levels, that their heart, their brain, their bones are protected at those levels. Obviously, libido is one great effect for patients, but that's not one of our main points. Patients will get better workouts, they'll have better motivation, they'll have better strength, they'll be less anxious, less depressed, and all of these things are affected by these levels.
Wow, that is really, I love it. I love it. I'm like, who can I call now? Because, a lot of times you end up dealing with individuals and you just think that, they're going through a tough time in their life. They're under a lot of stress, and you don't really think that they're going through a certain level of...
Correct. Most males will say to me, I haven't gotten a great workout in years. I've gained all this weight around my central abdominal area. I don't feel well. I don't feel right. And everybody's telling me that my levels are normal. That's not the case.
Well, they haven't done the proper testing.
Correct.
From what you have said, yes. Very, very cool. If you have any questions whatsoever for the doctor, please give us a call here at the station. The telephone number is 888-565-1470. She'd love to answer any questions that you might have concerning this. I would imagine that this is such a hot topic now because it's state of the art. We don't hear about that at all.
I did treatment for patients for many years with the utilization of bioidentical creams, some injectables. I waited quite some time to bring to our own practice the use of pellet therapy until I myself knew the company with which we utilized and was able to actually physically go there, see the compounding facility, the people who are in charge of the actual company help us do the dosing for patients, which is BioT, which is a great company and utilization of company. Their margin of error is around probably 2%. I was actually getting many patients throughout the surrounding north and south areas coming to me first. I don't feel well. This is what I'm on. I'm bleeding. I don't feel right. So before I brought it to my own practice, I waited quite some time to do so.
Wow. I'm excited. And excited for the women as well. I mean, there's always been something out there for women, but now that there's something there for men as well, and they're starting to identify what's going on with the hormones.
Absolutely.
But it would seem, so natural anyhow, because we're both, both genders have hormones that are dictating to us all the time and setting different levels, whether it's mental, emotional, physical. That has to do with your heart, etc.
Correct.
So that's wonderful.
Absolutely.
Now, does that have also something to do with erectile dysfunction?
It does. Yes.
Okay.
There are a couple of components, but yes, this helps a great deal with that factor. Absolutely.
Excellent.
When your levels are not appropriate, the blood vessels will not dilate, and that will be a problem.
Gotcha. So that goes for anybody, my male audience here, that is dealing with those issues. And in case, you can't call into the show tonight, you can always call All County Healthcare. Their telephone number is 888-717-7170. Ask for Maddie, because she can get you in touch with the doctor, just in case you weren't able to grab the show tonight. So you can always get a hold of Maddie. But how do they get a hold of you? We need to know that.
Sure. Our office phone number is 561-961-5456. We are happy to answer all of your questions. We also have evening hours, on Tuesdays and Thursdays that we see our patients as well. So for those patients that, for instance, work late, we are available to you. Absolutely.
And where are you located?
We are at 7301A West Palmetto Park Road at the corner of Powerline and Palmetto.
Okay. Okay, great. So, if you're dealing with some of these issues, and, this is pretty brand new information that we're receiving. If you have any questions whatsoever for the doctor, please give her a call.
Yes, absolutely.
So let's go back a little bit.
Sure.
What ignited this passion in you?
For our hormone therapy in patients?
For your specialty, for being an OB-GY.
I think from seeing so many patients go through these symptoms, it ignited a sense in myself to want to not just help, our patients through obviously their adolescent stages and their pregnancy stages, but many patients following pregnancy thereafter and as they age don't realize these symptoms that they have. And I wanted to find something that was healthy for patients to utilize to help them, which is, something that's obviously bioidentical and non-synthetic.
Yeah, that's what I was going to ask you, if there's any side effects.
So synthetic hormones are those hormones that we get through the pharmacy. That's your Premarin, your Prempro, your patches. The difference between them is, the route of how they're received in the body, their difference in steady state. The fact that things that you may take orally that are over, the regular pharmacy go through the liver pass mechanism and increase estrone, which is the bad estrogen in our body, which is interrelated to breast issues.
Wow.
Whereas when you're utilizing subcutaneous therapy, you are bypassing that route. So it's a safer means for patients, for both female and males.
Wow. Okay.
Yes.
Great.
Yes.
That is great. That is such great news. Now, just a question: does insurance cover this?
Insurance covers the costs for the consultations, for the visits, for your laboratory work. Yes, it does. What we utilize, excuse me, is FDA approved. The means by which it is placed in the procedures, that is what is, cost for patients. And if you are listening to our show today and you call us and come in, we shall issue you an additional 20% discount.
Oh, my goodness. Oh, thank you.
Yes.
That is wonderful. So give her a call. Your telephone number again, please.
Sure, is 561-961-5456.
Okay, great. Give her a call. Absolutely. Thank you.
You are welcome.
Thank you. I'm so excited. What are some of the other issues, especially sometimes when somebody's just had a baby and going through some of the issues hormonally
Sure.
with concerns of that?
Sure, absolutely. That is where my additional training from, the Anti-Aging Academy comes into play. Patients find, especially with the first child, that they are so involved in their child that they forget about themselves. They forget to eat certain foods. They forget to drink certain things. And you want to look at certain nutrient testing for patients, thyroid testing for patients.
Wow.
Sometimes patients are anemic leaving the hospital. Those things all need to be rechecked because a lot of times, again, these things in our system, when we have hormonal changes that occur, affect our system. Most of your general practitioners will not look to check those things. So patients, even who go through postpartum depression, you don't want to look to just place someone on an antidepressant. You want to know what the root of the cause is.
Well, that's important.
Yes.
And that's quite different because you're right. It's been many years ago since I was pregnant and had my daughters. But a lot of times, they just prescribe something immediate.
Correct.
And not really go through all the testing. So that's state of the art as well, isn't it? That they're doing all this deep
Additional testing, yes.
Yeah, wow.
Absolutely. And all these things we do through our office.
That's incredible. Now, are there any other areas that you delve into? We talked about the menopause and for both genders, and we also spoke about the pregnancy and postpartum blues and that kind of stuff.
Sure.
Anything else that you delve into?
Then we have our adolescent stages of life.
Wow.
And our adolescents today, I think, years ago for us, age, 16 is now our age 14 and 13. And, through environmental changes, through changes in foods, kids today are going through certain things at earlier stages. So again, patients who experience their cycles earlier in life, changes in hormones.
That. Yeah.
Excuse me.
That's okay.
These are all things
I have heard that.
We evaluate for, ages 12 and up. So again, when patients come in with certain complaints, certain acne, certain anxieties, I look at things in stages for patients. I look again at their thyroid levels. I look at their blood counts. We look at their nutrient levels. Even kids who have certain disorders like ADD and Asperger's, their nutrient levels are greatly affected. Those are all specific tests that, again, can be looked at and done to help optimize their current treatment and therapies. Kids that are, beginning to go through early stages of, prepubertal changes. All of these things are things that can be helped along by proper nutrients and treatments rather than just state-of-the-art medications.
Wow. That's so important. I have heard of that. I've heard of some of the adolescents at age 8.
Correct. Yes.
Starting their period.
8 and 9.
Yes.
Yes.
And there was just some talk that it was food related. Some of the growth hormones that were in some of the foods that they were eating.
Correct.
So
proper diet changes, exercise, proper nutrients are all important factors in treatment. Yes, absolutely.
Yes. So, and now I'd like to go a little bit into the birth control arena, because I think that that's something else that men and women both end up dealing with, because that changes their hormones as well.
Absolutely. There are many different options available to patients of all ages today. There's, of course, your low-dose birth control pills.
Yes.
There's your various methods of IUDs, from dependent upon, how long a patient wants birth control for.
Okay.
You have your Nexplanon, which is a progesterone-releasing agent that is a subcutaneous implant in the arm for 3 years.
Wow.
Yes.
That's very interesting.
There are various methods, and we talk to each patient. Each patient has their own comfort zone as to what they're going to be comfortable with. There isn't necessarily one, prescription for every patient. Again, every patient needs to be treated as an individual.
Absolutely. But I love the fact that you go through so many various testings and everything to make sure that you not only ensure the safety, but ensure the fact that what they're getting, they really need.
Correct. Yes.
That's amazing.
It is also important to note that no matter what hormone you are on, whether it is male or female involved, no matter what age, it depletes your body of vitamin and nutrient stores. So it is important that you take a multivitamin daily. It's important that you take a B complex, because they mostly deplete your body of vitamins Bs. Most people think your B12 is the be-all, end-all. It is not. Your B2, your B6, they're all important factors as well in production of thyroid metabolism, which then patients say, well, I'm fatigued, I'm tired, I have low energy, I'm gaining weight. Not necessarily from the pill that you're on, but it's because of what's happening in your body. So it's important to make sure that you take those nutrients as well.
Well, and that was one of my other questions too, is what are some of the side effects from these various
medications?
Medications.
So side effects are, which as I just mentioned, is low nutrients in the system, so make sure that you take those. Depending upon what you start, it doesn't matter what you start, your body's going to go through changes possibly of some breakthrough bleeding and spotting. It's not a period, it's breakthrough bleeding and spotting. Sometimes people can have breast tenderness, can have nausea, can have a little water retention. I always mention to patients it's important to take the birth control when you're ingesting it orally before bedtime with a snack, not an empty stomach. You wash your face, you brush your teeth, you have a snack beforehand, take your pill, and you go to sleep. It decreases those side effects and symptoms.
Wow, that's very interesting.
Yes.
Yeah, and I just want to go back one more time, because I'm just fascinated with this pellet.
Sure, absolutely. So are we. All of us in our office now, possibly to the exception of one person, have all had therapy, including myself.
Really?
And continue to do so because we feel well. Yes.
Oh, that is fabulous. Well, I have noticed, at least with myself, as I am getting older, and I don't have that same strength, and I'm not, able to hold on to the same muscle mass either.
Correct.
I'm like having to work out even harder just to try to build the muscle.
So low testosterone causes a decrease in muscle mass in the body, which then causes an increase in the fatty tissue cells and components that surround it.
Okay.
So once your therapy begins, and usually patients start feeling relief of symptoms within about 3 to 7 plus days, you'll start seeing a change, an increase in muscle mass in the body and a decrease in the fatty tissue cells and components. So initially, because muscle mass is weight...
I'm coming, okay. Does it get rid of crepey skin too?
That would be your estradiol, yes.
Okay,
yes.
yeah. I'm calling you tomorrow.
Absolutely, we would love to hear you.
Yeah, yes. Oh, that's so. Back to side effects with the pellets. Anything?
Correct. So about depending upon what levels you are starting at, and again, each patient is different. Most symptoms that you will find will be about 1 to 2% of patients may have some acne. Some people may have a little bit of, weight gain initially. Like I said, muscle mass is weight on a scale.
Okay.
That will subside. Some of it is water retention from your body, gaining back what it has not had in years. All of these are normal symptoms, and they all abate. And we have treatment for each of those things should you have a concern or issue to help you get to that steady state and optimize that feeling where you feel better again.
Oh, I'm in. It sounds great. Is there an age also? I'm just a few seconds here, but is there an age when you should stop taking birth control pills?
I usually make a recommendation to patients that by the age of 50, 51, which is where our average age of most patients will go through menopause, to stop the birth control pills and low-dose birth control pills that someone should be on. The dosages of the birth control pills are much higher than what we utilize in bioidentical hormone and pellet replacement therapy. So as you age, you should always be on something that is low dose to give you the symptom relief that you need and results that you need, but with the lowest dose possible. Yes.
Okay, great.
Yes.
Well, thank you so very much, Dr.
You are welcome. My pleasure.
Friedland. If you have any questions, please, again, you can give her a call at 561
961-5456.
Okay, great. And she's up here in Boca. She's just at the corner of Powerline and
Palmetto.
Yes. So if any of this sounds like something that you've been dealing with, please, by all means, give her a call. And if you haven't been able to catch the show, you can always call Maddie at All County Healthcare at 888-717-7170, and we can put you in touch with Dr. Friedland. Thank you again. It has been wonderful
Thank you for the opportunity.
learn all about this, the new things that are coming out, and especially for our men, too.
Correct.
That's very, very important, because we want them healthy and vibrant and
Absolutely.
virile.
That's correct.
It's all part of a good, healthy relationship. So don't leave. We've got a commercial break, and we will have another guest coming right on. So we'll be right back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Sounds fabulous. Hi. Hi, welcome back. I'm Lorena, your host for this evening. The show You and Your Doctor, where we're teaching you how to live a longer and healthier life. They are the proud sponsors, and we are very, very happy to be able to bring you this show every week on Tuesdays between 6 and 7. It's being presented by AMP2 TV, and you can find us live streaming on All County Healthcare Facebook page and also on AMP2 TV. So welcome back, and we've got another wonderful guest. But first of all, we've got Mr. David DePino, and he's coming in. He has been with Tenet Healthcare, and he's been really beneficial to us in the show and bringing on various doctors. So welcome, David. Thank you for coming. Thank you for being here.
Thank you, Lorena. Thank you for having me. And like you said, I'm with Tenet Florida Physician Services. We are a multi-specialty physician group, so employed physicians across South Florida. So that's Miami-Dade, Broward, and right here in Palm Beach County. We have physicians, everything from bariatrics, breast surgery, pediatrics. We have a huge cardiology line, neurology line as well. And I thank you. We've been able to have a lot of our doctors on your show. And our doctors are on staff at all 10 Tenet hospitals across South Florida. So we have 5 in Palm Beach County, 1 in Broward, and 5 in Miami-Dade.
Wow. Well, we're really grateful because, this show is all about educating our listeners and letting them know what type of doctors are out there, what their specialties are, especially if they're dealing with some health issues, and also, their choices for Medicare and some of the things that they need to know in order to make those choices for their insurance coverage when they hit that age 65. But it's been really beneficial to have these various doctors come and talk to us about their specialties, but also the state of the art. The new things that are coming out, it's just absolutely fascinating. Like the last doctor that was here, the Dr. Freedland, she was absolutely amazing in talking to us about the hormones and anti-aging and all the various things that the body goes through and what to watch out for.
That's the thing, medicine is moving so fast, and I work with 180 physicians and, like I said, 10 hospitals.
180?
Yeah, I do PR for 180. Not all of them need PR. Some of them are very established, but when you work for an employed physician group, you get a lot of physicians right out of education and training, like fellowship, and then you get a lot of physicians that are near the end of their career and don't want the hassle of staffing an office, renting it out, leasing and all that. So
yes, they want the workload to be a little bit lighter.
Because they're getting ready to retire. So we have a lot of physicians, young physicians, also older, more experienced physicians. So we kind of get both of them. So Tenet Florida Physician Services, like I said, employed physician group or across South Florida. We have doctors across so many different fields, and like I said, they're doing a lot of research. So we're able to share, once they're approved, certain trials and studies that our physicians are involved in.
Exactly. As a matter of fact, last week we had one of your doctors on, and he's running a couple of different research projects as well.
Definitely, and I'm working on a few press releases right now. There's so much going on. One of them I can talk about a little bit is a convergent procedure. So to treat atrial fibrillation, they normally do a cardiac ablation, which they go through the groin, interventionally up into the heart, and they almost, like, the way to describe it to the common people is they kind of do a couple burns on the heart to get the heart back in rhythm. Well, now there's a actually less invasive procedure that you have a cardiothoracic surgeon go through a small incision in the ribs, and then the interventional cardiologist comes up through the groin. They kind of meet on different sides of the heart, so they both do their work there. And those have been proven that down the road you won't need another treatment for atrial fibrillation.
Wow.
So they're much more effective. It's a quicker surgery. You actually have 2 physicians. So that's a huge study that's going on right now.
That is huge. What major breakthroughs. I love it.
Yeah, and it's very minimally invasive.
Yeah,
that's more important. So you're spending less time in the hospital, less recovery time, less chance of infection, so that kind of thing. So that's huge. So that's a cardiac electrophysiologist and a cardiac thoracic surgeon working together to eliminate a problem.
And I love how the doctors are coming together.
Yeah,
you know,
definitely.
they're becoming more holistic. You know, it's not that, oh no, I don't do that and you got to go see somebody else. They're really combining their energies and their expertise, you know, to help the patients. That's wonderful.
Yeah, the benefit, like you said, is to the patients.
Absolutely.
Another neat thing that's going on right now, we have, like I said before, a huge neurology team, and we're doing a lot of work with Parkinson's disease. So we have a neurologist who actually does deep brain stimulation, and what this does is actually turns off the tremors from Parkinson's disease and essential tremor. And that's done by, he works with a neurosurgeon. They put an electrode from the brain down to a neurotransmitter that's located just under the skin in the chest, and through electric impulses they're able to kind of turn off the tremor
That's
by a
incredible.
computer. Yeah.
Wow.
So that's huge.
That is huge.
And that's going on a little bit everywhere. These huge hospital systems across South Florida have deep brain stimulation, but it's normally like one or two physicians in that network that specialize. It's not a lot of physicians that know how to do this, but they control by the computer, so they can turn the tremor on and off.
Oh, goodness.
Yeah. So-
Who's getting a hold of that computer there?
Yeah,
huh?
well, it's a neurologist. So every 6 months they come in and they have it tweaked, and that's when the neurologist will turn the tremor back on. But it's amazing, and that's a surgery that's done. The patient is awake.
That's what I was going to ask you.
Surgery.
Oh, my goodness.
Well, they have to be when they map the brain.
Yeah.
They have to be awake because they have to tell the doctor. The doctor say, move your right hand all the way out, and then they'll have to do that so the doctor can work to map the brain properly.
Wow.
So yeah, that's amazing stuff.
That
that's
is
going
amazing. It sounds like sci-fi.
We have a lot of studies going on in orthopedics with growing knee tissue in and out of the lab. So that's something that's done for these ACL injuries. So there's a lot, and I can't wait to bring more doctors on. So-
That's really amazing. Growing tissue.
Yeah. They grow it in the lab. So you normal ACL tear, and now instead of the doctor going in and doing surgery and grabbing like a cadaver ligament or you've heard pig ligament they use, they're able to take a little bit of your tissue, grow it in the laboratory.
Oh my
And then
goodness.
put it back in your knee. So it's your own tissue. You're not using a cadaver ligament. So
That's amazing. So I think that we might have Dr. Bush.
oh, great.
Dr. Bush, are you there?
Hello, it's Dr. Bush. How are you doing?
I'm good. Dr. Bush is calling in from his phone. So he found it really, really important to come in and be a part of our show this evening. So I really do appreciate you calling in, Dr. Bush.
No problem. Thank you for having me.
You're welcome. So give us a little bit of insight, Dr. Bush. What is your specialty?
So I have multiple specialties. My primary specialty is I'm an osteopathic family medicine physician who specializes in interventional pain management and non-surgical orthopedics.
Oh, okay. Okay.
It's a mouthful. I function essentially along the levels of a physiatrist treating musculoskeletal pain and disorders and doing interventional pain procedures.
Wow, that sounds really interesting. Tell us a little bit more about that.
So everybody, no matter how healthy you are, or how young you are, or how mature you are, has aches and pains from day to day or from time to time. So at Mobility Spine and Sports, which is the practice that we've opened in Fort Lauderdale, we evaluate each patient for whatever their aches and pains are, and we will make a plan for them, treating them either with osteopathic manipulation, physical therapy modalities, and a series of or a combination of different types of injections. Now, the injections are done either blindly or using three-dimensional imaging or fluoroscopic guidance. And we do everything from basic trigger points all the way up through to platelet plasma and epidurals and that type of stuff.
Wow. And you said that you're located in Fort Lauderdale?
Yes, we're in Fort Lauderdale on the corner of Federal Highway and Oakland Park.
Oh, sure. Very familiar. I'm from that area as well.
Okay, so are you familiar with the round building?
Yes.
So we're located on the second floor of the round building.
I see. Isn't that Citibank or something?
It is currently Citibank, yes.
Okay.
It's the iconic round building right there.
It's very
Haven't a lot of
iconic.
movies been shot right there?
From what I understand, yeah. Yes.
A lot of professional movies, and from what I hear, a lot of home movies. There's a lot of stories that go along with that building.
Uh-oh. Well, I'm sure there are. But what's more important is that the fact that you are here on the phone with us. Doctors, you said you're a DO. Can you explain to us what the difference between a DO and an MD is?
Absolutely. In the United States, there's two types of physicians who are fully licensed to prescribe medications as well as to perform surgery. And that is an MD, or an allopathic physician, and a DO, or an osteopathic physician. The primary difference between the two, they both have the same basic science courses. They learn the same basic systems as far as human anatomy and physiology. But osteopaths are taught more of a holistic approach, meaning that if a patient complains to us of, say, pain in the right shoulder, we're aware that the pain could be coming from the shoulder or the neck, or it could also be a referral pattern from the gallbladder.
Oh.
So we're trained to look at things a little bit differently. And the other difference is that DOs, or osteopaths, we're trained in spinal manual manipulation, similar to what a chiropractor would do.
Oh, that's interesting.
Yeah, so we sort of have all the tools in our toolbox to treat musculoskeletal disorders.
Well, it sounds like that's quite a holistic approach. We were just talking, I was just talking here with David about how, I really find that a lot of doctors are going more holistic. They're just not treating one little particular area with the body. They're expanding their knowledge and expanding their experience and helping individuals, their patients, on a whole different level, taking into consideration everything that might be going on with the body. So it sounds as if that's something that you are doing as well.
Absolutely. It's something we've been doing for the last 15 years, and it just makes sense. If you go to, say, McDonald's drive-thru, you don't just get a hamburger. You also get the French fries and the drink and everything that goes with it. When you go to a doctor's office, you really can't go and just have your throat looked at by one doctor or your arm looked at by another doctor. People still do it, but it's very time-consuming and it's very expensive. So as osteopaths, in my practice, we literally take every aspect of your complaint, and we evaluate you from the family practice standpoint, from the musculoskeletal standpoint, from the orthopedic standpoint, from the neurology standpoint. And we treat everything under our roof right in-house.
Oh, that's very interesting. And I absolutely love the fact that you've been handling, you've taken your practice further. But I love the analogy about the McDonald's. It's kind of like, yes, in the olden times, you would go to the doctor and you'd be lucky to get a hamburger, maybe with a pickle, and then that would be it. But what you're doing, it sounds like you've got the buns, the ketchup, the mustard, the onions. You've got it all going there.
It's the McDLT and the Big Mac all together.
That's incredible. So, Dr. Bush, how do they get a hold of you? What's your telephone number? And can you say it kind of loud? It's a little faded.
Sure. Sorry about that. The office number is 954-414-7080. So that's 954-414-7080. It's called Mobility Spine and Sports, and we're located at the corner of Oakland Park Boulevard and Federal Highway in the iconic round building.
Yes. The big blue building.
It's a little Jetson-esque.
That's wonderful. So tell us, are there any other specialties that you're working on?
Absolutely. Alongside of the non-surgical stuff that we do, we also do non-surgical cosmetic stuff. So we're doing regenerative medicine from the cosmetic standpoint.
Whoops, I think I lost you a little bit here.
Can you hear me?
Oh, there you are. Okay. Can you repeat what you just said? The non-surgical cosmetic, did you say?
So we incorporated into the non-surgical orthopedic practice regenerative medicine, using different types of injections to stimulate the body's own mechanisms to stimulate the production of new progenitor cells or stem cells. So we're doing the same thing now in cosmetics.
Okay.
PRP type stuff.
Okay.
To increase the youthfulness of the skin by injecting different types of biologics or using the body's own PRP to stimulate the growth of new collagen under the surface of the skin to tighten the skin.
So can you tell our audience what PRP is? Because I don't think a lot of them will know that.
So PRP stands for platelet-rich plasma, and what that is the body is a pretty awesome thing. The body is designed to take care of itself and to run itself and to heal itself, and sometimes it gets into trouble. What PRP or platelet-rich plasma is we take we essentially take about 30 to 50 cc's of your own blood, and we spin it down in a very fast-moving centrifuge. The centrifuge separates out the platelets from the plasma, giving you the platelets, which are very, very high in, if you will, stem cells. So the very, very packed PRP or platelet-rich plasma, and then we re-inject it back into your body. So if you have, say, a torn rotator cuff or you have arthritis of your knee, we would take your own body's blood, we'd spin it down into platelet-rich plasma, and we'd inject it back into that joint. Once it's in that joint, it causes the body to start producing new, young collagen and cartilage.
That sounds really incredible.
Well, the human body has the ability to take care of itself. That's why people are living into their 90s and into their 100s now. It's a pretty awesome machine. And all we're doing is we're learning more and more about the human body and what it does for itself, and we're just extracting those mechanisms and putting them back into the body so that the body can take care of itself.
Okay. Now, I do have a question because I've talked to other doctors as well, and there seems to be more and more doing the stem cell research. Is it better to use your own blood and stem cells, or is it more beneficial to use a different stem cell from somebody who's much, much younger because they have more platelets?
So, the word stem cell is a very, very exciting combination of words, and it's also something that people are tiptoeing around a little bit.
Yes.
Stem cells, we all know stem cells from what we know about in utero or in a fetus or in the placenta.
Right.
You know that stem cells are what they're called pluripotent, or they're a type of virgin cell that no matter where you put it, it will essentially turn into that. If you put it into the spleen or into the pancreas, it's going to turn into spleen or pancreas type of cells. We don't extract stem cells from fetuses or from the placenta. So we use our own stem cells. And as an adult, we have our own stem cells. We have new cells being produced all the time. They're just a little bit older.
Okay.
So the whole, I don't know if you remember the lamb Dolly when they
Oh, yes. Yes, a long time ago, yes.
Yeah, so that's back, I think, the 80s. So the problem there is that if you take embryonic stem cells and you use those, they lack what's called apoptosis. Apoptosis is natural cell death.
Oh, okay. I was confused there for a moment. Go ahead. I'm sorry.
If you take embryonic cells and you use those to treat dysfunction, they don't have a shutoff switch necessarily. And if they don't have a shutoff switch, we can't control it. So that's why we're really not doing a lot with embryonic cells.
Oh, that's new news. Okay, great.
As adults, our cells have what's called apoptosis. They have natural cell death. So even stem cells in our body have a natural progression when that cell will live and it will die at a certain point. So there's no reason to use other people's stem cells when you have your own stem cells. I
understand that. So you're using that now for cosmetics, for injectables, or what are you using the PRP with, or is it just that you're putting the stem cells back into the collagen?
So with the PRP, you have a couple different options. Some doctors are doing PRP or vampire facials. where they just take the PRP and they use a dermapen and they make little small holes across the skin and they paint the PRP on. The way we're doing it is we're taking the PRP, we're spinning it down, so it's super rich in platelets, and then we're injecting that into the intracellular level under the skin, and we're doing that along with the Juvederm or the Radius or whatever other filler you want.
Okay.
And what that does is we're helping the body create its own matrix, if you will. So we're putting the PRP in, you get new stem cells, and you get the growth of new collagen. And at the same time, you've already put in this hyaluronic acid type of thing, which would be your Juvederm or your Radius or that kind of thing.
Okay. All right. I've heard of it being used with Sculptra as well.
Yes. All of the, pretty much all of the fillers, Bellafill, Artefill, Radius, all of the different fillers.
I see. Well, that's fabulous. Now, when you're dealing with the PRP, like with rotator cuff, how many treatments do you need before you see some sort of results?
Generally, with using PRP, you will sometimes only need one, but generally you need up to 3 treatments done about 6 to 8 weeks apart.
Okay.
So you have it done. Sometimes you can experience a little bit of increased pain following the procedures. 50% of patients feel immediately better. But there is the chance of feeling a little bit of increased pain because you are ultimately causing a little bit of increased inflammation within the body.
Okay. Do you have any questions for David?
Yeah, Dr. Bush, we started out talking a little bit about osteopathic, and I want to kind of do a 360 back to that. So osteopathic, you're a physician who uses osteopathic manipulation, so you're hands-on to treat the body. Can you explain a little bit more about that?
Absolutely. All osteopathic students are taught in the osteopathic diagnosis and treatment. Only about 5% of DOs are actually practicing. So every patient who comes to my practice, whether you're coming in for a torn rotator cuff or failed back surgery or spinal stenosis or headache or whatever, you're going to get a complete head-to-toe physical exam. We're going to take a look and see, if the ribs are out of alignment or if you've got some dysfunction. And then using a combination of a lot of different types of osteopathic manipulations, we adjust or realign and manipulate the body back into a more optimal position.
Oh, wow.
It's very similar to what a chiropractor does. And some people who have never had it, it makes a lot of noise. You've got some pops and some cracks, but it's not scary. You're not tearing ligaments. You're not breaking bones. All you're doing is you're releasing the pressure from within the joint. We think it's probably carbon dioxide being released. So when you have the manipulation and you hear the noises, it's actually a good thing.
Right. Well, I've got to say, thank you so very much for being on the show tonight. I really do appreciate you taking time out and calling us on your phone and giving us some insight as to what your specialty is and helping to educate us as well. Can you tell us again one more time what your telephone number is, your address, please?
Of course. So this is Dr. Darin Bush, and we are at Mobility Spine and Sports in Fort Lauderdale, Florida. The address is 3101 North Federal Highway, and we're in Suite 201. It's the second floor of the iconic round building.
Yes, it's the only one there, yes.
That's good.
Absolutely. Well, thank you so very much, and It's a pleasure, and hopefully we'll be able to have you on. We'd love to talk to you again.
I look forward to it. Be great, guys. Be well.
Okay, thank you so much.
Thank you, Dr. Bush.
Thank you. And thank you, David, for being
definitely.
here.
And I just want to say, I'm on his website right now. It's Mobility Spine and Sports. Great website. Ton of info if the listeners want to learn a little bit more.
Awesome.
Thank you.
Thank you tonight for being with us. And if there's anything that we might be able to answer for you, please call All County Healthcare. They are a Medicare certified home health center agency, and the telephone number is 888-717-7170. Good night.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program